Hi, we're back. We have another 10 drugs to go through today. We're going to go through drugs 11 through 20. Let's get started. So first we have hydrochlorothiazide. There's a brand name for this called Microzide. No one really uses it anymore, but that's the brand name. So you might still see that in literature. Hydrochlorothiazide is spelled like this, but we all call it HCTZ. Now, some labels will have that on there, especially if it's in combination with like lisinopril and hydrochlorothiazide. It's a lot to fit on a label and it doesn't always fit. So you might see lisinopril / HCTZ. That's why you really need to know HCTZ is the abbreviation for this medication. It's used for swelling or edema, which is swelling, and that's a collection of fluid in your extremities or even around the heart. It's also used to lower your blood pressure, so that's hypertension. All right, the class is a thiazide diuretic. So a diuretic is something that removes fluid, okay? And you have to really caution for patients with low renal function, the renal being the kidney. So if their kidneys aren't working properly, this is sort of something that they're going to have to be closely monitored for. And I have a question here. Why would you take this in the morning? Well, if your doctor has you taking it twice a day, then you are going to take it twice a day. But if you're told to take it once a day, morning is the best time to take it because it's going to make you urinate more. You don't want to be up all night peeing. Next, we have Ventolin, HFA. And the HFA, hydrofluoral, I can't remember what that stands for, actuator or something like that. It is, don't worry about the HFA part, that's part of the trade name, but it's a bronchodilator, it's an inhaler that contains albuterol, and it's short acting, so it's going to work quickly. It's going to work within a couple of minutes, and that's why sometimes this will be used 15 minutes before someone needs to exercise. I don't have this written on the slide, but what's really, really important about this is technique. You need 2 puffs generally, and if you're not using it properly, the second puff won't even go low enough. So you want to use the first puff. You want to write this down. Use the first puff, and we'll practice this in the lab if we haven't already. After a minute, it takes effect. Your lungs are more open. So then you're going to do the second puff. Then it can get lower into the alveoli. Okay, so I've seen people just being out in the public, taking their inhaler and just going squirt, squirt, 2 puffs. They didn't even exhale first. You need to exhale, squirt, inhale, hold 10 seconds, and then wait a minute so that it starts to take effect. Some people get a slight little tremor from it. That's actually normal. When we get into the pharmacology of this, we'll talk more about how this works in our bloodstream. Next, we have Neurontin. Now, the brand is not, I don't even know if it's available anymore. We still refer to it by the brand. Oh, one thing about albuterol, back for a second. There's a bunch of other brands. There's ProAir. There's Proventil. Okay. And there's different forms. ProAir actually went off the market and came out with a new one called ProAir. I think it's HFA, and but it's more of a powder than it is an aerosol. So, you don't need to know all those brands. I just want to point it out that you're going to really always be looking for this word here, albuterol. Okay, albuterol sulfate. You don't have to say the word sulfate, but albuterol. And when the prescription's written for the brand, you're probably going to be stuck with getting the branded generics that go with it. We'll talk about it later. Okay, to Neurontin, gabapentin. Gabapentin is used for post-herpetic neuralgia, which is a type of pain that folks get after they've had shingles, which is a virus you probably have heard of. And it's very painful. And that's where this drug came in handy. It kind of quiets the nerve endings. And that's the major indication, although now it's being used for neuropathy, which is like pain in your fingertips, like for a diabetic, or toes in your extremities, when you have nerve pain in your different places. So you'll find it used for different things. It's also used for seizures. Not that often, but it can be used for seizures. So these things have multiple uses. So yeah, there's a bunch of other uses. And we even see it in pets in the pharmacy. It works quite well for dogs. So we have dizziness as the main side effect. Okay, let's keep going. So next we have Zoloft. And Zoloft is a selective serotonin reuptake inhibitor. Big word. And we'll talk about that more later. But for now, you'll want to write that down. And it's abbreviated as SSRI. Okay. Let's put that up there. All right. So I wanted to show you labels because I think that it's kind of hard, doing all this remote to not really have a in-class discussion. So you'll see that there's a note on here on Zoloft to always dispense with the medication guide. That's something we have to do in pharmacy with certain medications. And we've actually now in my pharmacy gotten around it by putting a QR code on the prescription bottle. So I don't think I have any prescription bottles around right now, but on our pharmacy bottle where it has our pharmacy name, our phone number, there's a little QR code and you can scan that. Patient can scan that with their phone. They can also opt out of this, but from there they can get the med guide, which is the great reference that you guys are going to be filling in your spreadsheets with. And they often have those med guides for patients as a requirement when there's a boxed warning or maybe specific instructions on how to administer it, like with an inhaler. Under that, we have the NDC. That is the National Drug Code. And that is kind of like the UPC for prescriptions. We have storage on here, up here on the top left. And that will tell you room temperature. It's not going to have the dosing on here. That's too detailed. And this one's made in Germany. Lot number and expiration date will be on here too. Just wanted you to get a little orientation to what all is on the bottle. Okay, so this is being used mainly as an antidepressant, but it's also used for panic disorder and anxiety, and premenstrual dysphoric disorder, which is called PMDD. Used for obsessive compulsive disorder, which is OCD. There's a lot of different treatments. Primarily, you want to remember what SSRIs do. And we'll get into that in that chapter. But for now, just put SSRI and know it's a mental health drug or antidepressant as a broad category. All right, here's the box warning. So it seems really like almost like an oxymoron that something that's supposed to be helping as an antidepressant can increase your risk of suicide. It's particularly in young adults and teenagers. So it's very important that the whole family, or at least if it's a teen or people that are close, and the patient, of course, need to know if the symptoms worsen while on this. They need to let the doctor know. Also, it does take a couple of weeks, and this is going to be true for all the SSRIs. So remember this for all SSRIs. They all take a couple of weeks to take effect. So the patient needs to take it every single day. So there's no such thing as taking this one a day, PRN, one a day as needed. It is taken every single day. And when it's time to come off of it, it should be gradual. And that's true for all the SSRIs. Okay. So, I'm sorry. I talked about it before I showed it on the slide. 2 to 4 weeks for full effect. All right. Next we have Cozar. This is brand name Cozar. And it is generic, as you can see here, losartan. Don't worry about the potassium part. The drug class is ARB, angiotensin II receptor blocker. And you need to remember ARB. And if you write it down a couple times, you'll probably remember. So this is for hypertension, stroke prevention, and diabetic neuropathy, which is, we talked about that pain. It actually helps with that too. A lot of different things these medications can do. Primarily, you're going to see it for hypertension and some patients for preventing a stroke. The boxed warning is fetal toxicity. What's really important with this one is to monitor their renal function. So they're going to have labs to test their kidney function. And they are going to need to monitor their potassium levels. That's what K plus is. K plus is potassium. Next, we have Lasix. And this is another diuretic. Generic name is furosemide. It's specifically a loop diuretic. So if you remember in the beginning of this, we talked about HCTZ. That's a thiazide diuretic. This is a loop diuretic. Works in the little loop part of your kidney. We're not going to get into it. We don't need to get into that deep, but the little tubules it just works in different parts. It can deplete your potassium, so you're going to have to monitor potassium, right? And it's used primarily for congestive heart failure when the fluid is around the heart. It's a diuretic that helps with the swelling that's there. And of course, if it's a diuretic, we always want to take it in the morning if we have that option, if it's a once a day. You will see that drug can go very high in dosing if you end up working in private practice or the hospital. So next we have azithromycin or Z-Pak, Zithromax. T-Pack is another name for it. They call that a tri-pack, which is a 3-day course of Zithromax. And Z-Pak is a 5-day course. Antibiotic in the macrolide class. There's not many in the macrolide class, so you may as well just remember it. It's erythromycin, azithromycin, and clarithromycin. And they all have the same endings. That makes it kind of easy. The Z-Pak is what you're going to see the most, and this is a very, very common regimen for upper respiratory infections. Upper respiratory infection sounds like a big word, but it's from here, your lungs and up. Well, half your lungs and up, I think, because there's lower respiratory too. But it is going to be used for like sinuses and ear infections, throat infections. And the first day is 2 tablets or a double dose. So in this case, what would that be? 500 milligrams. And then the next day, every 24 hours, you're taking 1 tablet a day until it's all gone, and you finish in 5 days. All right. So it's well tolerated, and this is the best tolerated of all the macrolides. So that's why you see this one so much. We don't really even see erythromycin anymore. We don't see clarithromycin anymore. It's once in a while, but this is 99% of the time the macrolide of choice. All right, so I'm going to order here a little bit. We got Tylenol. This is an over-the-counter medication. It's not a prescription at this strength anyway. There is a prescription, just as a side note, so you know, in the hospital they have an injectable form. So don't be surprised if you see that one day if you're working in the hospital. Post-op surgery, they like to use that because it's not a narcotic and very safe, generally speaking, if the person doesn't have already liver problems. So let's get into that. So Tylenol and acetaminophen. The other name for it is called APAP, and I'm going to show you where APAP came from. It came from the chemical name N-acetyl para-aminophenol. That's the chemical name, and you can see why acetaminophen was better. You can actually see acetaminophen right in there. But where does APAP come from? Well, the letters don't line up, but that's it. APAP, acetyl para-aminophenol. So tried to get fancy with my animations for you. So you will see APAP a lot, and you need to know that's Tylenol. You need to know that's acetaminophen. Okay, and it has a box warning for liver toxicity. It's very important to know that. Someone with liver problems should not even be having it, right? And taking too much of it can cause liver damage, and it can be permanent. Adding it with alcohol can be toxic to your liver. All right, next up is tenormin, also known as atenolol, and it's a beta blocker. And look at the ending, OL. You're going to see several of those. Hypertension, angina, that's what it's primarily used for. And you know hypertension means blood pressure, so it lowers blood pressure. Angina is chest pain. And it's to be used with caution with patients with renal failure. Okay, and it should not be used with patients with heart failure. One of the things that it does well, and especially with propranolol, we'll have that one drug later, but these all-alls, these beta blockers, is they're great for lowering the pulse, which in turn lowers the blood pressure. But you can't do that with a patient who has heart failure. All right, we've got insulin next. And this one is regular insulin. Insulin regular. That's how you're going to find it when you go to look it up. It's a short-acting insulin. It works within 30 minutes, and it lasts for about 5 to 8 hours. All right. It is a clear solution. That's important to know, because if you are in nursing and you end up administering medications, this is one of those where you're going to look in the vial. It's an injection. Okay. This is not a pill. And you're going to look through it, like my drink here, and make sure it's not cloudy. Well, this looks pretty cloudy. I hold it up to the light and look for particles. And if it is, you won't use it. So this is going to be kept refrigerated, and if it has been frozen at all, it cannot be used. It can come out at room temperature, and this is really good for the patients to know that they have 30 days and they need to throw it out after 30 days. And a lot of them use it up before then. But if they have animals are using it for, they're using such a small dose, they need to know they're going to throw it out and need to throw it out in 30 days. So it's something to put the expiration date on, write it on the bottle, and say, throw it out after this date. Okay. So this is where insulin can be extremely dangerous. You're going to see in the lab, and we're going to talk about this if we haven't already, that the syringe is specific for insulin. It has to be used for insulin. Has graduations on here that are marked in units of insulin, and it's called a U100 insulin. That syringe has to match the insulin. The insulin has to be U100. And we mentioned that because there is an insulin made by this same company that is a U500. That means, let me tell you what U100 means. Every 1 milliliter can have 100 units in it. Okay, now my syringe might be shorter. I was going to break that. My syringe could be shorter and have only 50 units in it, but the concentration is going to be the same. It's still going to be a milliliter would have 100 units in it. That's the concentration. Okay, so if it's U500, that means a milliliter is going to have 500 units in it. That's a lot. That's so much stronger. So if you grab the syringe might look the same, except that it says U500 on it, but you grab the wrong insulin and you put it in the wrong syringe, you could cause a lot of harm. So it could be could put a patient in a deadly error, could put the patient in a coma. So we always assume it's going to be U100, but I have patients that are on the U500. What's great is the pens. They do make them in pens now, and I don't have one here to show you. I want to show you. You'll get to see it later. We'll say this is the pen. And instead of it being a vial of insulin, the pen, you screw a little needle tip on, and you go beep. Well, not in your arm. You grab your stomach, and you beep. You're going to put it there. So the pens are super convenient because you just dial in your dose. And we'll get to see that too. But that's what I want you to know about the insulin. The take home is be very, very careful if you ever see U500. Okay. And also know about the storage. All right. So we're done for this 10 here, and fill in your spreadsheets and put in your notes. Okay. We'll see you in the next video, and have a great day studying.